gut makes important enzymes that reduce pain, make us feel more full, even change our cholesterol and improve good numbers of cholesterol. The gut makes 95% of our serotonin, so conditions such as anxiety or depression or fatigue can be largely gut-based. The gut makes certain compounds, what are called short-chain fatty acids, that will help to reduce diabetes or weight gain. The gut is where the immune system decides whether or not it's on overdrive or whether or not it's too low. And so that balance between a good surveillance of immune system all starts in the gut. So the gut is not merely about gas and bloating and bowel movements, but the gut has a lot to do with everything that's happening in your system. The gut is the size of a tennis court, and if we create inflammation over something the size of a tennis court in our gut, that has an effect in the rest of our body. Inflammation is one of the key components that drives most of modern conditions, most of the things that people come in for. Inflammation plays a role in weight gain. Inflammation plays a role in depression. Inflammation plays a role in spurring neurologic conditions as well as autoimmune conditions. Inflammation can be largely responsible for fatigue and poor sleep at night. An important part to understanding integrative medicine is to understand that we are not here to only define a diagnosis. That's critical and that's useful and that will guide us in terms of treatment. But the diagnosis is not the only part. That is the part that standard of care is highly focused on. We will still be focused on your diagnosis, but at the same time we work on a diagnosis, we want to realize that there are underlying processes that will affect a majority of conditions that people suffer from. So at the same time, while we're figuring out whether or not you have depression or anxiety, whether or not you have lupus, or whether or not you have rheumatoid arthritis, we want to figure out why. And that why is a process. And when you begin to look at the processes as well as the condition, this is really the marriage that gives you an integrative approach. Integrative medicine will seek to not only understand the condition, for example, depression, but will also seek to understand why. And that why is often a process that relates back to inflammation, free radicals, dietary deficiencies, toxic body burden, and possibly most important, mental emotional stress. When we run through the myriad of conditions out there, we're hard-pressed to find conditions that will not improve when you also address this underlying process. The difference is like saying, rather than just using a drug that will block the symptom of a condition, that we want to figure out why that condition is happening in the first place and address those pieces as well. Let me drill down further. Let's use an example to understand this. Multiple sclerosis is a debilitating neurologic condition where the outside of the nerve begins to unravel. The myelin sheath begins to demyelinate, and you can no longer carry a signal that tells the muscles how to work. In the standard of care world right now, there's very exciting discoveries around MS. There's a drug that blocks a certain part of the immune system that is overactive in MS. It blocks something called an interleukin, in this case IL-17. And the drug looks very favorable in terms of some of our recent clinical trials. Why is that immune cell upregulated in the first place? And when we begin to trace that backwards, what we realize is one of the key reasons that that immune cell could have gotten out of balance in the first place is because of eating foods that you were exposed to that ignited the immune system to begin with. This is why there's a dysregulation. But absolutely, we should use the drug, we should block what's happening, we should decrease this interleukin, but at the same time, we should ask the question why and address the process, change the diet. And now when you do these things, when you recognize there's a process and you work on that as well, you have a chance of slowing the progression of pathology, potentially moving things towards remission, being able to lower different medications that you're on, and not just sit and wait for the pathology to progress at the most rapid rate possible. A point that is fundamental to integrative medicine is the point of genetics as well as environment. And many of us have the belief that our pathologies, our signs and symptoms are something that we got from mom, dad, grandma, and grandpa that came to us through our genetics, and now because of those genetics, these are things that we will inevitably express. However, this couldn't be further from the case, and in fact, places like the World Cancer Foundation recognize that as much as 70% of cancers are not genetic, but are environmental. What do I mean by that? Well, that our genetics are not just something that are waiting, sitting there, and inevitably going to express themselves. But there's a switch that decides from whether your genetics turn from health to pathology. And that switch is the environment that those genetics are in daily. Let me say it another way. For example, BRCA1 and 2 genes that are associated with breast cancer and ovarian cancer. Genes that are associated with these conditions being so important that women are often feel that they must go and have preventative mastectomy because they feel that these genetics will express themselves because they have this BRCA1 and 2. Well, interestingly, these genes in 1940 had half of the chance of going on to breast cancer as they do today. Same gene, 50% difference in risk of breast cancer. What am I saying? The environment that the gene is in is different. That the environment of today is different than 1940. And that environment is a complicated environment. It's one of environmental toxicity. It's one of less nutrients in our food. It is one of more stress on our system. The environment of today is one that fuels that process more greatly than the environment of the past. But again, just like we're not a victim of our genetics, we are also not a victim of the environment that we live in. We can make active choices to change the environment that our genes are surrounded in. This is why it becomes so important to think about organic food. And if you can't always do organic, go to your dietitians and our handbook and look for the list of the Dirty Dozen and the Clean 15. These are lists that will tell you where the most pesticides are used and when you can save some pennies and you don't always have to eat organic. This is why the education becomes so important. Well, you'll learn about pesticides, something called glyphosate, that 70,000 tons are dumped into our environment, and that not only increase our toxic body burden, but literally pull minerals out of the food because these pesticides were originally what are called chelators, to claw, from the Greek to claw, and so are literally leaving our food more nutritionally deficient than the past. However, it's not all gloom and doom. We can choose healthy foods in order to put our genetics in a better environment. You will do testing here that will show levels of nutritional deficiencies so we can build up what I call the lightweight bulletproof vest. What is that? Something that protects you but doesn't weigh you down. And so initially, as we're rebuilding tissue health, what you will find is that most likely your practitioner will be more aggressive. They will put you on more than one supplement at a time, and they will work aggressively to put you back to a state of normalcy. This is much like when we first start going to a gym. It is much harder to lose weight than to maintain that weight loss. Initially, your practitioner working with you, many different supplements, many different interventions, surrounding you with different therapies to get you back to normal. But as you move with us through the 5-visit process, you will see that we will move towards maintenance. Again, that lightweight bulletproof vest, something that protects you but doesn't weigh you down. And the way we get there is largely through education. The way we get there is through an understanding about it's the foods you eat and the exercise that you're doing that will be hugely important in terms of your walk to health. We know exercise is good for us, but again, it's that education that really confirms that idea. For example, 5 times 30 minutes a week decreases your risk of cancer by half. That is according to the American Cancer Society. 5 times for 30 minutes decreases your risk of dementia by 60%. That is the Journal of Neurology. 5 times for 30 minutes also gives you as much cardiovascular benefit as someone who's training for a triathlon. It's not that we have to do huge amounts of exercise, but we have to be consistent. And so from diabetes to weight loss to cancer to cognitive decline, exercise is one of those things that we must incorporate into our life in order to have normalcy. The second thing is making good food choices and work with your dietitian about what that means for you. But it's not about a diet, but it's about a lifestyle change and making sure that you're incorporating at least 5 servings of vegetables. I'll give you one of those as fruit. But when we make our plate largely plant-based with good lean organic sources of protein, this is going to be the diet that's most helpful. Why? Because even if you're not sensitive to grains, even if you're not sensitive to wheat, even if you're not sensitive to dairy, these can be things that are still on their own create more inflammation. The grains, for example, soak up more of the pesticides than our other foods out there, and so they can directly cause symptoms of irritable bowel syndrome, but they can directly cause inflammation that fuels a pathology as well. So regardless of sensitivities, these are going to be some of the changes that we want you to actually use into your diet.